Can hear
How's it
us at
going?
all. Jesus Christ.
Are we live yet?
Kat,
Yeah.
can you hear us?
I think we're live. Yeah.
Are
What?
we
Can
live? I
Kat,
don't.
Yeah, I can
I
hear
don't
you.
know if we're live. It didn't say the you're live thing. It didn't do that. You're live.
I see live in the top left.
I
Well, we're
know.
live.
Okay,
Hold on.
Oh
awesome.
my
Hi
God, you
guys, we're
guys.
live.
Hi guys. Please send donations to the state of Georgia
Or
for
directly
internet.
to the Health Tech Talk Show, and I will put the link in the chat, you guys, and feel free to give us any amount of money. It's better than nothing, and we can get a better Wi-Fi scenario at this point for our lovely host Kat McDavitt, who's going to save America.
From Georgia with no internet.
It's fine. There's less
Kat,
more impossible fates have happened.
give us a sign.
Listen, you guys, I promise I am not a poor person. And I mean, not that there's anything wrong with being a poor person. I do spend like $200 a month on Wi-Fi. I have fiber. I think it doesn't matter. Like, I think I live in the South and it legitimately doesn't matter.
But you know what? You
So,
made a very good
yeah.
point. You're on calls with me throughout the week, and I never have a problem, and you're never pixelated. But 4:30 on a Friday, without a doubt, you are having an issue.
Yeah. Yep, here we are. So allegedly our deck is uploading. We'll see if that's true. It may not be true, but this is a show, like we're going to have a lot of stuff happening. We're also going to talk about fraud. So we got this guy, he's here, uh, Gabe Drapos.
Gabe
Am I saying his
from
name right? You
Pearl
should just
Health,
tell the
right
world.
here. Here he
Yeah, and
is.
I read y'all's report and then we put it on the internet. And because we knew the other guy, we knew Euban, he's great. And so we figured you must
He
be
is
legit.
great. I'll do my
Yeah.
best, but that's a
Yeah.
hard act to follow.
Yeah,
Awesome.
so we'll see what's going to happen. Also, Michael showed up here. Michael's here. He's back from the Vortex, which is Epic MGM. So We'll bring him up later. He looks like he might be sunburnt. Maybe they had a beach this year. We don't
He is
know.
a
We'll
little
find out.
pinkish.
Yeah. Okay. Okay. We're gonna stick you in the back because, like, maybe you know the drill. Maybe you watch the show. Hopefully, someone told you
I
what's
explained
happening.
to him.
Yeah. We just don't want you to, We'll just let you. It's fine. Okay. Melissa, what's even happening?
What?
What? Okay, great. All right, you're done too. Okay, hey Lisa, what's up?
It's like my
I
nightmare of like
slept.
being it's like my nightmare of being stuck in like a permanent Zoom call where the other person has like bad signal. Dear Lord, Kat,
It's me.
we need to move
It's me.
we need
I
to
know.
rescue you from the great state of Georgia right now. But yeah,
I
not much.
know.
I mean, we've had quite a week. I am just want to shout out my friends at Civitas. I am wearing the Civitas shirt for the upcoming conference. Join us in Anaheim September 28th. Woohoo! Here you go, guys. That's what this is. Um, and yeah, just living the dream, cat, really. Wow, what a week.
Yeah, me too. You know what I'd say is the greatest thing about you being on a call with me every Friday at 4:30 where I have terrible internet is I actually feel like my internet is great on this side. And so it's frustrating for me too. Only because I'm like, why is she so mad at me?
I'm so mad at you. Really, what's also great is that we would normally be catching up on Marco Polo, but instead we are broadcasting it live to the world.
Yeah, you guys, Lisa and I have both been like working on separately ridiculous things. I have not slept in
Yep,
several days, so apologies
that's
in
right.
advance for any more than usual
Correct.
ridiculousness. Trying to save something I love.
That's
May or may
right.
not work, TBD. But check us out here in our pink flamingo outfits. I feel like we
That's
look
right.
exceptionally business lady. All right,
That's right.
so we got like it's like a long news show today. There's like a lot of news that happened, but
A lot of news.
in case everybody didn't know, because I feel like everyone in health tech knows this, Jonathan Bush is running for governor of Maine. And listen,
He
I'm
is.
not mad. I'm not mad about this. Like, I already told this guy, Leslie and I told him in New York at Tech Week that we will totally move Incenna to Maine if he wins.
And also, he has his own podcast too. He's a podcast bro.
He does. Yeah, he has a nonprofit now called Maine for Keeps. I think he's like committed. I'm into it. And he told me and Leslie that Maine is going to go from worst to first in business.
Wow.
Not
I
mad.
have seen his
So,
beautiful home and in Maine. It's in Maine. So he has lived there for quite some time now, and he's very committed, huge fan of Maine. He also, I believe an EMT, or he still is an EMT. I don't know what the status
Yeah,
is.
he was.
Yep.
Yeah, yeah,
And
yeah,
he just his
yeah,
latest podcast was about the idea of community paramedicine in rural communities, which I think is a really cool idea. So go Jonathan, make it happen.
yeah, yeah. That's totally rad. I think he was an EMT prior to his Athena days, so
That's right.
that's. Anyway, we like Jonathan Bush. Everybody knows that.
I love rich
Okay.
people who have real jobs, like totally like
Speaking of rich,
amazing.
speaking of rich people who have real jobs, we did not give Lisa's new podcast, or people who will. We're going to talk about a lot of rich people on this show today. So, maybe one day we'll be one of them, but we did not give Lisa and her new podcast proper due in the last show because I don't know what was
Amaze.
happening. Probably everything and nothing at the same time. But Lisa does have a real, actual produced podcast where her internet
Yep.
does not go out. She does not have a co-host who's well, her guest internet may go out, but that's funny. It's called the Policy Stack. Yeah, the Policy Stack. It's I think not an Innovator property, or is it? I don't actually know.
It is.
It
I
is.
mean, whatever. It's my podcast. My friends at Innovator are
You
paying
got
for
yep.
the podcasting software, so that's great. But no, we're not talking specifically about Innovator stuff. We're talking about policy stuff, my favorite. And it's a chance for me to go into more detail with other policy nerds, which is my fave thing. The first episode, as I noted, was with Cody Kinsley, and the next episode is coming out on Monday with a surprise guest who also likes to talk about Medicaid nerd stuff. So more really soon.
Well, I have insider knowledge about who that is, and I will be checking that out. So great. Congratulations, everybody. If you would like to hear Lisa in a non-pixelated form with a non-pixelated co-host, go check her out here. Okay, speaking of rich people, Stack
Damn.
published top list of rich people in healthcare. Um, there appear to be a lot of them. I have some thoughts on this, mostly like, so there's only one on here that I'm like, and that would be Davita. Um, like this other
Yeah, I'm
guy,
a little.
BioNTech.
I'm wondering if the BioNTech guy is going to get fired because I mean, didn't we just cancel mRNA vaccines? Like, yikes.
Well, right, but I think he's going to be okay because he made $300 million. But like something for everybody to know here is like if like a lot of these, if you read the article, like so read the article and look at the color coding here. These are options. So and apparently the
Yeah,
BioNTech
totally.
guy he traditionally holds them through their full 10-year period. So these are
Realized
options.
options. Good for
Yeah,
him.
like I mean, and in biotech in general, like I'm not a biotech person, but I understand the people who live in that space. You go big or you don't. Like, and it's a very
Right,
small chance, but
right,
if
right.
you hit it, like you are a 300 millionaire in like a day, like this guy, although he's obviously much more than a 300 millionaire. But I get that. This the only one that I was like was I'm sure there's others that I didn't look into, but Davita, yeah. I mean, this guy also is winning on options by the growth of people needing dialysis in America. His business has grown. He has eaten competition. And if we're all bitching about Epic being a monopoly, I would encourage us all to look at Davita, a company that
Yeah,
actually does profit
yeah,
from
yeah.
people never getting better.
Yeah, I know. It's one of those incentive stories where you're like, "Ooh, I don't know about that one." Yeah, I mean, you can see
Yeah,
a lot of pharma stuff in here, med device. That's where probably the bigger money is, I guess I would say, if you look at the top list of healthcare.
yeah, yeah. Eli Lilly, I mean,
Respect, respect.
yeah. I mean, these guys are, I look forward to them one day becoming donors of Zoria Foundation. No big deal.
That's actually a
Okay.
real, like, incredible, like, American success story, Eli Lilly. Like, literally, you had Novo Nordisk, like, straight out of the gate with, like, I mean, to be fair, if you look at the history, Novo and Eli, came out with GLP-1s that could be used in humans in the way they are, with the success story they are around the same time. But, like, what a success story for Eli Lilly to come back and be like, Novo Nordisk, we're gonna eat your lunch and then some. And they did.
Yeah. And then we're going to launch a telehealth platform where we only prescribe our drugs.
Great.
I mean, that is America. I don't know what to tell you.
Yeah.
What's also
Yeah.
America is that we can have two large EHR competitors continuing to poke each other in the eye.
Jesus.
And so every year at Epic user group
Oh,
meeting, it
cheesy.
appears, I don't know every year, but at least in the past few years that we've been aware, Oracle buys a bunch of wrapped cars or rents them or whatever, wraps a bunch of cars with
Rents
Oracle
a bunch of
slogans
cars.
and drives around Verona, Wisconsin. Like, I don't know.
Yeah, Michael
I
Marchant is saying that his hotel had an Oracle developer meeting in it in Verona for a UGM, which is also funny. Like, I do appreciate this. Also, he stole some of their pizza, which I also appreciate.
good job, Michael.
Um,
Good to get
you
free food.
know, this is just silly, right? But this is also even sillier, right? Because of course, Oracle, these aren't Oracle employees, right? This is some company that does event activations. But still, you just find whatever you can find to poke them in the eye.
Yeah,
There you go.
it's super funny. I will say that I have a wise friend who often tells me, "Cat, don't get in a fight with a skunk unless you can kill it." But I do appreciate the Epic Twitter, Epic X account, which is objectively hilarious. So go check them out. I think this is funny. There are also some hilarious commenters on X about this. Aimless driving in an ugly rap, the UX UI irony of it all. And then this one was, I guess the statement here is your EHR shouldn't be a UFO, which is unreliable, fragmented, and outdated. Many of the comments were, that sounds like Oracle. And this
I
lovely
know.
lady said, those are synonyms for Cerner. So I will say,
Listen,
like, this is objectively hilarious in my opinion.
it is pretty
Yeah,
funny. It is
I
pretty
agree,
funny.
Christian. It is like so I do think if I was in charge of Epic's marketing or Cerner's market, Oracle, whoever the hell we're talking about, I would probably not spend my money on this approach. But I, as a regular human, do think it's hilarious. Maybe that's what they're going for. TBD. Anyway, what
Yeah.
else we got? Oh, so I had childcare issues and we could not go to UGM. So we stole this guy's screenshots from LinkedIn, who was there. I don't know
Yeah,
this guy,
the
but
reporters who were there said they weren't allowed to take pictures, but like people just took pictures who weren't
this
reporters.
guy did. Who
So
I mean, we weren't
IDK.
there.
Yeah,
We're also not reporters, so we stole these
right.
off this guy's LinkedIn. I mean, stealing from a public source. So anyway, so there was some cool stuff. Lisa, I know you had many debates with Brendan Keeler about Epic this week.
I
tell us,
did.
tell us what you learned.
Yeah, I mean, listen, like I think that, there were a million articles written about like, oh, like Epic is killing all of the ambient scribes, Epic is killing all of the other companies in the space, blah blah blah. You know, listen, it's really hard to deliver on this stuff, right? If you look at their own timelines they put out there, they're like 2026, like Q, like H2 2026, right? These things aren't built yet, right? They go out and announce them, and to be fair, like they usually do a true up at the next year's UGM and say, like, here's what we did, and here's what we didn't do, here's what was canceled, whatever. So just like everyone take a little breath here, right? This is a these they announced a lot of really complex stuff. And it takes a lot to deploy and deliver on those things. But also, like, in the past, there's been a good amount of scrutiny over companies with big platforms like this who do this kind of thing, as it relates to other innovative companies that have been built around EHRs. I don't know what's going to happen. I think that there's like a lot of space in healthcare and a lot of improvements to be made, and it probably needs all of us, right? So, like, good for them. Like, I hope they make healthcare better for everybody who uses Epic and other platforms. I hope they do.
Yeah, I agree. Oh, I don't, Michael. Someone has to read that and tell me what that says because I don't know. I don't
He's
know if I
talking
know.
about what I just said about every year at UGM they announce what they're going to do, and then
Oh,
they do a true up the next year and say, here's what we actually did.
okay, cool.
Yeah,
That sounds great.
cool.
Also, some of the news I was interested in is that their Cosmos product has been used to train a bunch of AI things. Um,
Yeah. This was a
yeah,
real question mark here. So when we were looking at Cosmos a couple of years ago, this is, in a previous role, in a previous situation, what we were told was that Cosmos was this really amazing platform that Epic had created as a collaboration between all of their big, like, academic medical system customers who wanted to do research for research's sake. not for commercialization. And specifically, they said like Cosmos cannot be commercialized, right? Like those health systems cannot go and like make money off the data that's being shared in that research collaboration. And now what they're saying is, well, we used all of those data to train these AI tools or these LLMs or whatever it is to create these, applications. And that feels a little bit like, wait a minute. What did you mean exactly with no commercialization? Because this isn't free. It's not being given away for free, I'm pretty sure.
Yeah, I mean, I'm sure, I mean, this is weird, right? I will say, I have some thoughts that I am about to share, but
Oh, yeah. Share away.
yes, I am sharing. So, like, first, it's probably great, and their tools are probably better than what's out there using just data, publicly available data sets and things like that, because it is real data from Epic users, which is a large portion of the country. That's meaningful. Rural, urban, like they've kind of got it all, right? I agree with that. What is stressful, and to be clearly said, I'm sure it was all in the T's and C's, right? We always talk about reading the T's and
I'm
C's. So
sure it
like,
was in the
I'm
T's and
sure
C's.
in
I'm
there
sure
it
it
said
was. That's right.
Epic's
That's
going to
right.
use this for some stuff. Sign here to share your
Totes.
data with the Cosmos. I
Totes.
think, and I obviously have not seen the T's and C's, but having seen other companies' T's and C's with this kind of stuff, it's like reading the Apple agreement, right? You're just, they lead with this is going to be for,
Scroll.
academic research purposes, whatever it might be. And I've been a big fan of Cosmos too. I think a lot of sites doing public health work and like they've been able to use this and be meaningful. I do wonder if everybody knew what they were signing up for. But Lisa, knowing how rabid the Epic user base is about Epic, I wonder if it was the first line item, if they still would have said shit. Like,
Yeah, I mean, I think
honestly, they
you
probably would have.
you can't have it both ways. The Epic of a couple years ago was saying like we are like this is non-commercial, it's for research, it's for the good of humanity, blah blah blah. And then now this, right? And that's just the story has changed. And I get it, right? Like they probably realized pretty quickly, like, hey, we gotta do that. We gotta do that. We're not gonna be able to deliver on something better than what anybody else has if we have to go out and acquire different data or get new agreements or whatever it is. I assume there was something that was, I'm sure they have this only the smartest and most clever and most incredible lawyers over there in Verona. I'm sure that they did. I'm sure this was all above board. I have no doubt. But like,
Yeah. Yeah.
the public story was very different than this a couple years ago.
Yeah. Yeah, I agree. I'll also say that right now there's the big data sharing efforts, going on, the interoperability pledge, all that at CMS. Things like this, I think, illustrate how hard it's going to be to get companies to free up their data because we
For
used to sell data to health
sure.
plans. That
For
was cool. We
sure.
used to sell a shit ton of data. Maybe we
Sure.
still do.
For
Now
sure.
your data has value for training AI models and all kinds of other use cases. So it will continue to be one hell of a slog to get companies to share this in a meaningful and high volume way. Despite what I think every VC we're working with AI startups is hoping that pledge will turn into.
Yeah,
Yeah.
absolutely. Absolutely.
Speaking of
Um,
more AI, we have Penny's coding.
Professional coding.
Yeah,
What
yeah.
could go wrong there? Nothing.
I don't know. No,
It's fine.
not mad about the RCM use cases, like whatever. We're going to talk a little bit more about
Yeah. Uh,
clinical use cases for AI and how they get
Yep.
paid for in a second here. But Lisa, last thing is you sent me this guy talking
Dude.
about the AI scribe. I actually read most of his posts and
Oh
then I got
man.
tired because Lisa, I thought there was like
Oh
a word limit on LinkedIn posts and this guy's was so long. But
no.
like,
No, it's an
yeah, but he's
article, baby.
basically there's the big. Tell us about the big drama.
The big drama is that, so, a couple years ago, I guess Epic did this like workshop thing with a couple of scribe companies, including a bridge, including Nuance, Dragon, whatever the hell it's called, went through a whole variety of name changes. Um, and, you know, and then there was kind of this like, oh, we're sort of partnering with these guys with workshop and a bridge, then raised $1 billion. And everyone's like, a bridge is blessed by Epic. It's going to be amazing. And then Epic came out and said, well, we are obviously launching our own scribe. And then everyone's like, ooh, a week before, oh, Epic is launching a Scribe. Oh my God, they're going to kill all of the companies. And then the day of, they announce it and they're like, it's powered by Microsoft Dragon. And everyone's like, what are you talking about? And so basically, like, what this comes down to is like a bigger and more platform dominancy company like asserted their platform dominance, and basically the scribe is coming out of the DAX Copilot. That's what they ended up calling this Dragon Nuance Copilot thing. It's a partnership with Microsoft in some way, shape, or form. And you can read Brendan's posts and you can read Joshua's posts about the whole details behind that and the framing, whether it was like a marketing blunder or intentional or whatever it was. Bottom line is like this is a win for like really, really big companies and a bit surprising for people who thought that they were just building their own little ambient scribe. No, no, no. This is a much bigger, like deeper partnership with Microsoft, really entrenching those entrenched players forever. So
Yeah.
interesting, and lots of thoughts about this that we don't even need to get into. Like read Brendan's post. It's he's a good take on this, I would say.
He seems to know a lot about Epic.
He does. He does know a lot
Yeah.
about it. All
All right, so moving into things that the government is doing. So Dan Brillman might be the new head of Medicaid.
Yeah, yeah,
This is the Unite
yeah,
Us guy.
yeah,
Um,
yeah.
I will also say that Capri Snap is mentioned throughout this article as a fucking baller. And I will say, like,
He
I don't know.
is.
I mean, this is back to
She's
like
cool.
January when every 20 seconds there was a new national coordinator, including both me and Lisa at the same time and separately. So you never know who's going to be in line for anything, is what I'll say about that. But I do love that this article highlighted Caprice, her expertise, my experience with her, and Lisa, I know you've had some experience too, is
She's
she's a
great.
freaking go-getter. She's
Super smart
innovative and
person.
she's trying to make really needed changes. And I'm hopeful that she'll continue in this Medicaid counselor role to the
I don't think
secretary.
I don't think she wants a permanent job, but I hope very much she stays in this really critical advisory role. I mean, the reality is like Caprice, you're awesome. You know what you're doing. You might have to keep the job because TBD. I guess I'd always say like
For
when
America.
yeah, for America. By the way, like when something like this, like someone's maybe nominated or maybe in the role, when that gets into like the trade press or whatever, ask yourself why, right? Like somebody leak that story to this journalistic outlet. And there's a reason they did it. Like just to ask yourself why. And I would just say, you know, it's always controversial to bring in people who have just like tech backgrounds and not policy backgrounds. Chris Klomp, friend of many here, is a fantastic guy who had that background. Um, and I think he's doing a great job so far. But it's always a question when somebody comes in like out of the blue. I would just say, why was this leaked to the press right now?
Yeah.
What's behind it? Like, ask yourself that question, dear fans of the talk show. Why?
Yeah. Because I think, I
It
mean,
wasn't
how
me,
many
just to be
different,
clear. Wasn't me. Was not
yeah,
me.
was not
Wasn't
me
us.
either. But yeah, I mean, let's just all remember how we all were 1,000,000% sure that Bobby Jindal was going to be the secretary,
That's
and then
right.
it was a different Bobby.
That's right.
Well,
Different Bobby.
yeah. So anyway, who knows? But I will say that the fact is that Caprice is awesome. So the article got that right,
Yeah,
and
she's
that's
great.
good. Um, in this article, it does talk about one of the, we believe, initiatives for Medicaid is that CMS wants to bring AI into state Medicaid agencies. We're going to talk about AI for a minute here. We got the Chai here doing the Tiger team. I continue to believe that the states, for reasons that are not their fault in many ways, in some cases, I'm sure there's some fault there, but these state benefit systems are freaking jacked, y'all. Like they are messed up, they are expensive, they are clunky, and they are complex because
That's right.
Medicaid is complex. I continue to think that this is overly optimistic that AI is going to solve all of our problems because you are going to have to do 56 different versions.
That's right.
But speaking of AI, so this guy Sebastian Caleri, he's a former Palantir. I think he's a Palantir co-founder, or
I'm
whatever. He was very
I'm
involved
sure.
in some sort of leadership position at the Palantir. He's now at 8VC, which is a VC firm, which you can probably tell. A couple weeks ago, I actually saved this because I was looking at it like, huh. he has a LinkedIn post a couple weeks old now where he's arguing that we need to take the labor part out of the RVU methodology, and we need to use that to pay for AI, or we need some sort of payment calculator or payment code for AI, because if we take the labor out of it because of AI, I guess tech firms should be paid for that and not clinicians or the facilities that are billing. So I really wanted to like understand this because I've been told this guy is super smart. And it sounds like he is super smart. I read through, I just like completely and fundamentally disagree that we should be using the RVU method to consider paying for AI. Like, because Lisa, I think what does make sense to me, instead of adding a new code or modifying this system, I thought we were all trying to move to value-based care anyway, where if you make people better and keep them from being sick, you make more money, and thus you can afford to buy things like the AI.
So,
What am I
okay,
missing?
yeah. So first of all, like a lot of people have been getting the vibes that the administration generally and the policy apparatus are giving up on value-based care. I think that is a fundamental mistake, and they should instead work on making sure that people are in, these entities are in true risk-based arrangements, not just like window dressing, but that's my personal opinion. I think people are getting those vibes that they're just like it didn't work, we're gonna do something else. That's the first thing. I still think we absolutely must move to paying on outcomes in every
Mm-hmm.
place we possibly can. That's my like number one thing. Number two, this guy and AVC in general. So these guys had some kind of prior warning, I would say, because the Medicare physician fee schedule and the Medicare outpatient prospective payment system proposed rules from CMS, which are like a standard yearly thing. Both of those had a request for information, request for comment about how CMS should pay for like AI SaaS tools. So, like, this is a question that the administration is asking people, the industry, whatever. And these 8VC guys have been like doing a lot of these like thought leadership things in the last couple of months here. So, either they were asked this privately or they knew somehow or they intuited or they had some kind of vibe or they were asking for this whatever, but like this is related to questions that the administration is asking the industry and the public, like how do you think we should pay for AI tools? I do not agree with this outcome. I just
Yeah.
fundamentally disagree. But like that's what this is about. It's about the like, is the administration moving away from VBC? Number one. And then number two, the administration's asking technology companies, industries, innovator, others, like everybody, the public through these payment rules, like, how should we pay for this? And I think you pay on outcomes, man. I don't think you can just let's not I do not want to perpetuate this broken fee for service payment system. No, I say no.
Yeah, I agree. I think so. I will say this about this piece because there's a lot.
Christian has a
I
good
cut
comment here
out.
too.
Right,
That's
right.
right.
So and a lot of smart people contributed to this. I cut off there. You can go read this article. Follow Sebastian. I do think that if the answer is we're continuing for we're using fee for service and we're using the RVU formula, this is actually a really smart piece. I think it just totally ignores that there are other ways to do this because we
Yeah.
kind of have proven over many, many decades that RVU is not good. Like it's not working. It's bankrupting America and it isn't producing healthier people. So I think I'm like, well, why don't we start at the beginning and say like, okay, we want an outcome. Let's set a fair price for that outcome. You get to that outcome however the hell you want. If you want to have a bunch of nurses and doctors and you want to have a lot and you want to throw people at the problem, but you get that outcome, great. You get the same price as a doctor who's leveraging AI and augmenting their practice. Like, great, maybe they save money, but he or she is able to then pay for the technology because of the savings, I would think. So
Yeah.
I don't know. I mean, maybe that's just me living in 2024, but I don't know. I didn't get this. I will also say many of these people are incentivized because they're portfolio companies to get a billing code because it's faster and easier than working on a risk shared model or risk bearing model where you might not get paid or your thing might not work. We might prove your thing doesn't work. So,
Hey,
you know,
looking at like margin improvements or like cost avoidance, right? That's a lot harder. You have to do a lot more work to be like, no, I can actually afford to do this if I could reduce my cost as much or improve my margin by this. That's like hard work and there's risk involved. And by the way, very few like technology companies or VC-backed technology companies want to take that kind of financial risk. I get it. I understand.
Totally, I totally get it, and so that's why I think his article is written for the intended purpose, which is to help those companies make more money. I do think it's
Bam.
thoughtful. I just think the model is totally wrong. He also had a thoughtful tweet here because I always try to think like when I'm really mad about something, like what's the other side here? He said some groups will try to block healthcare AI, citing safety and the risk of hallucinations, but will totally ignore the risk associated with lack of access and good medical expertise and the benefits of AI. I think this is a lot like the vaccine argument. I mean, we're arguing the same thing with vaccines. We're saying a few people might have gotten autism or died from vaccines, therefore let's throw the baby out with the bathwater. So I think
Bro, you
we
don't
need
get
to,
autism from vaccine. You don't even say that. You don't even say it like that, Kat. I'm gonna
well,
fire you. I'm
I'm,
gonna delete
yeah,
you from this show. I'm gonna take you
everybody
off
knows,
air.
everybody knows what I'm talking about. I'm just saying we can't have this argument both ways. Like either
Totally.
we're either helping the masses or
Totally.
we're not, right? Like, come on. So,
Yeah.
but I do think it is fair to think about like what are the benefits, and I don't think we should stop using AI in healthcare. To be clear, I just think that we should use it in a value-based model, and I'm sad that that
Yeah,
has not been
yeah,
clear.
yeah, yeah,
Yeah.
exactly. And whatever. No one ever talks about the counterfactual. Anyway, keep going.
Anyway, so moving into other things the government is doing. So there's the Rural Health Transformation Fund. There's lots of buzz on that. It's $50 billion. Everybody thinks they're going to make a lot of money off of it, or recoup all of the money they will lose from some of the looming Medicaid cuts. There's a lot of controversy about this. There's a lot of speculation. Also, we had a very smart reporter friend actually look into some of the comments that were allegedly made at MESC by some
Uh-huh.
CMS officials. Apparently, that did never happen.
Nope. Nope.
Didn't happen.
L-
So disregard America. Disregard. Didn't happen. Yeah.
Yeah. This thing,
But
this is my favorite like dorky policy example right here. What's on the screen here? This urban hospitals with rural status and Medicare. This is just one of those examples where if you create a policy like road, like somebody's gonna go down that road for sure.
yeah. So the situation here is that there are many very urban hospitals that somehow have achieved dual status as rural hospitals as well. So you can see here, these are the number one. We had a very smart, a legal friend of the show who, talked to us at length about this. And obviously there's some here it's hard to justify, and that makes it scary that some rural providers will not be able to get their fair share of the Rural Health Transformation Fund, because the definition of rural is like obviously pretty broad here. There are some here that make sense. Like I am from the Lehigh Valley, Lehigh County, Pennsylvania, aka the Slate Belt. So you drive 30 minutes, you are in Allentown, Pennsylvania. You drive 20 minutes back in the other direction, there is nothing at all. And so Lehigh Valley Hospitals does operate rural hospitals and urban hospitals. I get that. I do not know how we're just how NYP is
Or
running.
Cedars Sinai in
Yeah,
LA. Like, stop it.
I,
Stop it.
I don't know.
Stop it.
So anyway, it does sound like there are a bunch of people in our great Congress who are thinking about this and theoretically making sure this goes to the good places. But
Yeah,
TBD, everybody
yeah,
should check this out. Something to think about. Um,
totally.
we had a friend just send us this too. This is just kind of hilarious. This is, I don't think, has much to do with healthcare, but this is an executive order. And I'm a little delirious. I've been trying to say something near and dear to my heart with opioids, and it it's really likely not going to make it, and I'm very sad about that. And then I read this executive order that we are establishing a national design studio and a new chief design officer. Motherfucker, Lisa, we couldn't even get a goddamn chief patient officer, but we
Yeah,
can get
listen,
a
listen,
to
listen.
make our
Also,
websites prettier.
also, chief design officer with that like serif font. Get out of here. Get
What,
out of
Lisa,
here.
what I want to know is why isn't the AI
BS.
making our nation's websites more
Yeah,
usable?
yeah, yeah, yeah.
Why
I'd
do
like
we need
some
a new
AI
office
trash.
when we're using AI for nurses and doctors and we're trying to figure out how to pay more money to the fake doctors? Like, how are we paying money for a new chief design officer? I am confused.
Listen, let's get a chief patient officer first. Come on, we can do it.
Yeah, I don't know. Jesus Christ. Anyway, okay. Um, uh, the RC for Tefka, sorry, I was trying to remember how I described that, is like pro transparency these days and is getting a bunch. If you are a random person on the internet
That's
or
right.
in real life, you can answer this call for individuals interested in sharing your expertise to help advance Tefka implementation. I have actually into this. I hope that it works, and I hope they get some really good feedback and listen to people who may have alternate viewpoints.
Okay.
Your deadline is September 4th, America. Okay, we're going to start talking about fraud now. Can we talk about CMS embracing the Gen Zs and running a chili cook-off for fraud?
I think this is like so cute and dorky. I love it so
I kind of
much.
love it.
I
Yeah,
love it.
like I kind of love it too. Like I agree. Also, everybody knows I think Dr. Oz is like pretty great. Like that guy is definitely like risen to the top, in my opinion, of people trying to do good stuff and also embracing the wonder of show business.
It's amazing. I will say this is in a important a legacy of the CMS AI Health Outcomes Challenge, which was launched by yours truly a number of years ago now. And so I just love that they keep doing this kind of stuff. And this one is very cute. It's cuter than
At least
my little
I
thing
love
was.
that. Like claim the credit, Lisa. This was
That's right.
we stayed at the shoulders of giants.
They have a cuter little logo than we did, though. Ours was like
It is a cute
very like
logo.
uninspiring.
Do you think they used AI for this, or did they consult the new design officer?
I don't think they did either. I think that they have a designer on staff who did this little,
Okay.
who whipped this one up.
Okay. Okay. Good to know. All right. So yeah, anyway, so speaking of fraud, this is great. Go look at this. It's on Instagram. I think it's on the X. I think there's a video on LinkedIn with Dr. Oz talking about the
Yeah.
chili cook-off.
Yeah.
It does seem like really legit, and it sounds like they're going to take you seriously. Anyone can apply, and then I think they round it down to 10 companies who then get a bunch of CMS data to do stuff. So seems cool. Everybody should do it
Yeah.
who knows how to do it. I mean, I don't know how to do that, but I'm here for it. So speaking of fraud, like we said at the beginning of the show, we did this, like, we were covering the skin substitute thing, which seems like pretty ridiculous. And then I think it was like catheters, Lisa. We were talking about that. And we were
Mhm.
talking about some of the recently released stats and reports. And a op-ed published under the by Kim Brandt, who we also like, COO of CMS. And it does seem like there actually is a lot of fraud in DME. And there was also a CMMI, not model, but like a CMMI talking point about potentially addressing DME in value-based care models. So I Googled 5 minutes before our show and found this article, white paper by Pearl Health from our friend Yuban Park, Dr. Yuban Park, and this guy, Gabe Drapos, who has joined us for the show. Oh my God, here he is.
Here he
Yeah.
is.
And so I think Yuban was like, you should check this out in a comment. And then we were like, come on the show. And you said, sounds good.
That was it.
That's it.
It was
So you're here.
here we are. Serendipity. Great to be here.
Amazing.
Yeah. So Gabe, do an official introduction for our loyal fans.
Sure. Yeah, absolutely. So Gabe Drapos, COO here at Pearl Health. We're in the value-based care enablement space. So we take risk on total cost of care, Medicare risk, alongside providers across the country in 46 states, and use technology to help them understand which patients they need to engage with. So have a lot of thoughts on how AI and VBC fit very well together, because that's a match made in heaven.
What do you think about our recent argument where we both agreed with each other?
You're spot on. I mean, so
right.
you don't need to.
Usually Lisa's spot
on. You don't need to create new billing codes to fund AI if you're pushing people into total cost of care with prospective payments. And so ACO Reach is a great example of that. You have sort of a monthly advance on shared savings intended to invest in transforming organizations to better impact in a value-based care format. And so you can use that to invest in AI, that if you're reducing the cost of care and generating shared savings, you're getting the cash flow to fund it in the year and then benefiting at the end of the year from the good work that you're doing. So why create sort of a new billing system if we're trying to move to outcomes here?
Yeah.
Well, also just like why perpetuate the fee-for-service universe when we have been, like, we've already made more than one step in the direction away from fee-for-service. Why would we build on that existing convoluted, like, very historically problematic model? Why would we do that? We can do more.
100%. And so, Gabe, you want to talk about fraud, like, imagine your billing units of AI utilization. Talk about a hard thing to monitor. I can't imagine.
Actually, I just thought of a new
Yeah.
business idea and I have to go, so I can start that right now. And see you guys later. Don't
Oh,
see
but
see you never.
great argument, right? Wow, that is wild. And then I wonder if the AIs will like clump together, and even the fraud risk detecting AIs will be like, that one was good. That one was good.
Exactly. Collusion
Yeah,
amongst the artificial
that's what I'm saying.
intelligence.
This is how it starts. This is how it starts. So, Gabe, you just said you guys are like full risk.
Yes,
So
absolutely.
that's really cool. So when I said on the show, when we went over your white paper, I was like, I don't know who these guys are. And you were like, what the, Lisa was like, what the hell, Cat? This is like a legitimate company.
Yeah.
Um, tell us more, like, what has been your experience? Like, clearly it seems you're making money because you're here.
Well, apparently you only allow rich people on the show, it sounds like.
Oh,
This is only a
Jesus
rich person
Christ,
show.
Kat,
Yeah.
stop it.
Yeah.
Do not get us in that. No.
I wish we were
False.
rich. We're not. I mean, we're rich enough that
False.
we can self-fund our talk show pretty much. So yeah.
Great.
No, but like, so what's the story? Like,
yeah, so look, value-based care, not an easy landscape to be in. I think a lot of people thought it would be easier than it is. A lot of people got into the space thinking you can risk code your patients to a profit like the MA plans have been for a long time. A lot of those chickens are coming home to roost. We've been, instead focusing on managing total cost of care and quality outcomes and predictive models to identify patients that are likely to have, ED utilization or inpatient utilization that we can get ahead of. And it's a model that's, proven popular. We're managing about 200,000 Medicare patients right now in partnership with providers across the country.
do you make money?
So we're always under embargo for sharing shared savings until CMS releases that.
Yes, this is true.
So I will say we are trending into a great place.
Well,
Things are good. That's what I like to hear.
Aledade happily shares very loudly the results of their shared savings every year, and they usually do at least a couple press releases about it. So I encourage you to be equally as shouty for good results.
Yeah,
As soon as I'm allowed to, I will.
Great.
Okay, so Gabe, when we saw Abe Sutton and I forget who he was talking with, maybe Dr. Oz or maybe it was the secretary, I don't know. And he mentioned fraud and DME being a focus and how they could use some sort of CMMI model to reduce fraud and also impact outcomes a little bit more. Everybody was like, what are they talking about? Well, and it was this whole thing. And the DME suppliers appear to be lobbying pretty hard and all that stuff. But then reading some of the recent press on things like the skin substitutes and the urinary catheters or whatever we brought up on our last show. And then actually reading your white paper, I was like, oh, I can see why value-based organizations would not be into the current way DME is used, distributed, billed for, et cetera. Can you just level set, just give our audience an overview of what the hell's going on there?
Yeah, absolutely. And I will plug, Abe and I about a year ago wrote an article in Health Affairs on a different area that's ripe for abuse and risk adjustment. So definitely would recommend checking that out. I'm just going to self-promote for a second there. But now I will answer your question.
I did read that, by the way, just so
Wait,
you know.
what is it? I didn't read it.
Well, we'll put it in the Slack. Go ahead.
The argument is basically that as a country, we waste so much money and so much of doctors' time asking them to confirm a patient has a diagnosis. And as we have seen in sort of especially the Medicare Advantage space, there are tons of moral hazard incentives out there to inflate the diagnoses that patients have. And so, look, it's the modern era. We just had a segment talking about AI. We can absolutely, with the wealth of data that CMS has, infer the risk score of any patient in the country. And so let's just do that. Are you going to get it 100% right on an individual patient? No. But are you going to, let's say you have a patient that goes to the gastroenterologist all the time, has had colonoscopies, is on Stelara, they probably have Crohn's disease or ulcerative colitis. This is one of many examples I could give you. And so why do we as an industry do that? You can create a more fair, precise system and take all that work off of overburdened providers. That was the argument.
Okay, that seems rational. Okay, now tell us about DME.
I try to stay rational.
It's kind of the argument of like, why do I have to file taxes? Like the government has all my data. Like it's truly the same.
I'll sign on to that one too.
Yeah, no, it's a great argument, right? It's like, you do have the data. Like there is work to be done to connect it and to decide that CMS has the authority to use it in certain ways, whether there's, legal or regulatory, fine. But like we could do that. It's not impossible, right? Like that's the argument. Which same thing with taxes. Like, do I need to file taxes? No, you already know basically all the money that I've earned ever, and it's tracked pretty well by our banking system. So like, what do I got to fill out that form?
Yeah, 100%. All right, but you did ask me a question.
Yes.
Is DME ripe with fraud?
Is DME bullshit?
Okay, so DME is an area that is particularly susceptible to fraud. To the sort of LinkedIn headline here, do I think all DME companies are corrupt? No. I think it's a little bit more nuanced than that, but I appreciate the punchiness. I think the corruption can come in a number of ways. So
right.
DME, there have been DME companies absolutely that have been indicted and convicted for schemes like incentivizing providers to prescribe DME that's not necessary. There have been providers that have accepted kickbacks for overprescribing. There's the way more clearly fraudulent side of things where like literally it just never was delivered to the patient, because in the background, what do you have? You have something that's a lot harder to trace, and you have a vulnerable population. Like if I'm 85, do I know if I got 100 or 500 catheters in the last year? No. I just know that catheters were shipped to my house and there's no physician in the middle, right? And then you have the wild end of the spectrum, which is sort of like more, it's apparently like a South Florida phenomenon. There was like a 2019 article around this where people just create fake, tax IDs for fake companies and claim they are delivering DME services to patients. Actually, here's the fun fact. There were a lot of former drug dealers that converted into becoming DME fraudsters because there was an article on this in an interview. They say cool. They made more money. B, it was harder to get caught. And because when you do get sort of quote unquote caught, instead of like the DEA,
that's a white collar crime, baby. That's a white collar crime.
You get a warning letter of like, hey, we noticed suspicious activity under your tax ID. So they just move. They move along. And then, yeah, you're absolutely right. See, if they do get caught, they get treated like white collar criminals. They're not going to.
That's right, baby. South Florida, home of DME fraud. Sorry, guys, but also true.
Wow. That's incredible.
Yikes.
Wow.
Huh. But I think the thing here that I find really interesting and obviously gives me a little tiny bit of hope, and I hope that our friends at CMS also hear this and know this, which is that when entities, whether it's a clinician, a physician, a health system, an enabler of some kind, an entity that is taking total cost of care risk is out there, they have the natural incentive to look and say, this seems fraudulent. I am concerned about not meeting the mark here and being able to deliver care in that total cost of care benchmark. And I have the incentive to go and look and scratch below the surface and call that number up and look at that data a little more closely versus somebody in a fee-for-service arrangement any day of the week. And this is not just related to Pearl, or this has been actually pretty widespread. NACOS, the Organization for Accountable Care Organizations, like tons of examples now of these entities saying like, hey, hang on a second. Like, this seems fraudulent. Let me find out. And then let me like tell like the government about it and get enforcement on it. And that's because there are incentives around total cost of care, not just like how many more billing codes can I sling today? And that matters.
No, it absolutely does. ACOs caught the catheter thing first. They caught
Right.
the skin graft thing first. I'll say the system is not fully fixed yet, insofar as like
No,
it takes years to get some of that
totally.
resolved. And if it's blowing up your shared savings and now you owe the government losses, you're still cutting a check until they come back and say, okay, actually that was fraud. And so I think we, the wiser model, doing some prior auth in traditional Medicare, where there's, focused prior auth, like not sort of what you see in coming out of insurers where they're doing it way too much, but in specific areas where there's frequent fraud, waste, and abuse, I think is a great thing to get upstream of this. But yeah, it's I would almost love a bounty system of like, hey, if we can identify this first.
Actually, we love paying on outcomes, and we also love telling government what we think they should do. And so, dear CMS, dear Kim Brandt, who's actually really like leading the charge on the fraud, waste, and abuse stuff, like, let's get a bounty system. No joke.
Yeah, bounty
Let's
hunters
do
and
that.
fraud, waste, and abuse.
It would make my
OMG.
job sound a lot cooler if I got to say I was
Yeah.
a fraud bounty hunter. So.
Bounty
Crushing
hunter.
fraud, waste, and abuse.
Think of the logo, Lisa. I know they've never adopted the
Dude.
Freedom Health Data Network. There's still time. We'll see what happens there. Okay, so Gabe, so what could CMMI model look like that would address fraud with DME, or at least waste, right? Because waste is real, even if it's not as scary sounding as fraud and abuse.
Yeah, I think, so there, I would say you're going to see partnerships between these new wiser entities and ACOs. Absolutely. And so, ACOs getting all of the claims data, these wiser entities, I don't know what we're going to end up calling them once they're actually here, but wisers for now. I don't know. We'll workshop the name. But partnering between the two so that there is a feedback loop between those who are incentivized to monitor upstream of a claim ever coming through. And then I think, as you said, we have all of the data on these patients. I'd love to see, consistent with HIPAA and all of that, some ACO consortiums getting together and monitoring this at really big scale. Because if, let's say we have 200,000 lives, Aledade has a few 100,000 lives, like we can pool all of that data together amongst a number of us and really get some early warning systems going. That would be great.
Do we need a new consortium? Should we start one right now? What are we going to do?
Yeah,
What's the plan?
I'm always down to start a consortium. Let's go.
Okay, that's great. The consortium for crushing
I know
waste, and
Euban
abuse
would be down too. So we can bring Euban back on the show and get it going live.
I mean, we'll do it. Listen, I am a persuasive person. I feel like I don't feel persuasive today. Normally, I feel very persuasive.
Normally you are.
Well, that's your Wi-Fi. If you had good Wi-Fi today,
that's
I don't
right.
think that's it. I think that adds to my charm. But yeah.
Anyway.
Okay. So well, can we talk a little bit about just like waste with DME, right? Like, what's the story there? Is it just like I've heard about these like auto shipments that like never turn off? Like, what is there a solution for that? Like, how big is that problem and how easy is it to solve?
I mean, I would say if Amazon can get me something in like 3 hours when I order it online, we can absolutely modernize the delivery of DME in a way that sort of avoids some of that. I think it comes back to how much accountability is there here and how much oversight is there. I think one of the frustrating things right now is, for instance, the skin graft situation has, as of now, to date, not been ruled what they call suspected anomalous and high spend billing. I can tell you, we've seen situations where we've had billings of the skin graft is billed on the square centimeter. You do the math, and they've billed more than the surface area of the human body. And so, like, if that doesn't clear the bar, like, it's clearly, unless they're making some sort of weird advanced sort of prosthetic skin suit, that is not. I mean, I don't know. Maybe AI and the robots are trying to look human or something, but it's not legitimate. And so I think, honestly, more so than we need to tack towards the direction of being proactive on this and hitting with a faster, sort of harder sledgehammer, because these things are going to keep cropping up. Like, catheters got caught onto, and then they quickly moved on to this thing. And as soon as we sort of get a grapple on this, it'll be a whack-a-mole and the next one will pop up. So the system needs to catch up. I think, frankly, the MACs being regional sort of old school entities as opposed to a national cloud-based claims processing of Medicare would go a long way too.
Huh.
Well, I mean, that's a whole nother road to go down here, but it's incredibly complex. I mean, I'm sure you know at this point in what you all have been building and delivering on for so many years, the complexities of like local coverage determinations and versus national coverage determinations, things that don't make a lot of sense for a national program. Um, it's very interesting. I do think that local-ish entities are going to be better, in many cases, will be better sourced to understand the, I don't know, the fabric, if you will, of a particular healthcare community. But I don't know what that number of entities are, how you could achieve that otherwise. If you could achieve that in a different way beyond, some stuff will be very
No, I hear
obvious
you.
in data, and some things will be like, well, that's this system who does this here, and we have, because again, healthcare is quite local, and we have all these different types of constellations of health systems and providers and rural environments and urban environments. It is quite complex and different, but I don't know what that number is or what that level of abstraction is either to understand.
I totally agree on the local thing. I will say though that, even when there are those local guidelines, I mean, you see situations of MACs still processing claims that don't meet those guidelines.
Well, that's why the wiser model, right? That's why
Yeah.
even to propose it is like, well, these things are not even supposed to be covered, and yet they're being paid for. And so why would that payment be processed? Question mark? I don't know.
Yeah, I don't know, but I guess I guess it's great that we're and I do like the wiser model, and it's great that we're going to add a layer of monitoring. But why isn't that logic just built into the claims process?
For sure, for sure.
Yeah.
Well, I can tell you one of the reasons I know for sure is that, these Macs, they are they are like high security, very slow uh claims processing systems, right? They can't immediately adopt new technology because they are required to use FedRAMP High, which is like a very, very restrictive requirement for the way that technology, cloud-based technology can work with their systems, which is almost impossible for any innovative technology companies to achieve. There's
Yeah.
only one, and it starts with a P, big old P, and the rest is Palantir. And so, like, I
Talented.
don't know that that's going to work for all of them. And so, one who I will not name, who I've spoken to, was like, yeah, like, we do AI like locally. Like, we literally have like, we have like GPUs that we bought so we can run stuff in a closed, like on-prem environment. Imagine
Huh.
the cost. Imagine the like how difficult it would be to like do new things, right? So like on the one hand, like I see the argument, and on the other hand, they are under a lot of restrictions by the federal government
Yeah.
to not be doing the coolest, best, most useful things, which is just stuff like that. The list, just like a big old rabbit hole of like, why does this exist?
The government procurement process is bullshit, and I think,
It is.
of things that I think should be doged, if we're still
FedRAMP
doing that.
high.
Yeah, like the entire federal procurement process just needs to get rebuilt from the ground.
Let
But
me
that
do it.
sounds
I'll
that's
be the one person. I'll say yes or no to everything, just like the
I
king.
mean, I would approve of that, Lisa. I think that would
That's
be
right.
great.
Thank
But
you. I do have good
yeah,
judgment.
okay. So Gabe, we've got one more minute. Uh, what do you want to tell America about value-based care? Do you think the administration is supportive or not?
No, absolutely. I actually do think they're going to announce, I would say, I don't know when, but I would be shocked if they don't announce an ongoing commitment to full risk total cost of care.
Crazy.
The people running the show are, in many ways, were in the last administration or are, in the networks of people in the last administration. And that was direct contracting, which is now ACO REACH. That was the GEO model was maybe the most aggressive total cost of care
Yeah.
recommendation in CMS's history. And so I think we're going to see an ongoing consolidation. What I'd love to see is innovation towards how we bring specialists into this more holistically, because all of these models are really oriented around primary care, critical. But if we don't get specialists and hospitals sort of fully invested in this as well, and not in sort of like, bundles and things like that, but holistic responsibility for total cost of care in an integrated model, we're just going to keep sort of chipping away at incremental progress.
Yeah, I mean, that's where the money is as well, right? Like who's spending money? It's certainly primary care, like is important for directing spend to some extent, but like the money is being spent by specialists. It's not
Yeah.
being spent in the other direction. It's specialists and RX and DME and imaging and all those kind of things. So yeah,
Exactly.
I
Yeah.
agree, Gabe.
Yeah, Gabe, I think we like you, and I'm sure it's not only because we agree with you.
Yeah,
Well,
totally.
I'm sure that doesn't hurt.
No.
I mean,
But when you're ready to talk about amazing results, you just come back on the show, you let us
yeah,
know. Like
just call
we
us.
wanna, yeah, just let us know.
Yeah, we'll be here,
Absolutely.
probably.
Happy to.
All right. Thanks, y'all.
Awesome.
Thank you for coming, Gabe.
Thanks,
Happy
Gabe. Thanks,
weekend.
everybody. Bye.